In this video, we will be reviewing the post-op instructions after a total hip replacement surgery. After your total hip replacement surgery, you will have to follow precautions for 6 to 8 weeks. Your surgeon wants you to follow these precautions. Keep center of balance over both legs, and no twisting over the operated leg. Take small steps when turning. Try to get up and walk every hour during the day, but only for 5 to 10 minutes maximum. It is very important that you don't overdo it. You should also avoid extreme movements, such as no deep bending or squatting past 90 degrees at the hip. Avoid low seating or picking items up from the floor. No lunging or backward stepping that extends the operated leg behind the body, and no crossing of the legs. Expect pain and swelling after your surgery. Significant pain can vary after your hip replacement. Swelling will start to set in, especially the first week after your surgery, and you'll also start to see some bruising develop, both in front of the leg and behind the leg. Make sure you're taking your pain medications as needed, elevating and icing for the swelling, and just monitor the bruising as this is expected after your surgery. Ice will help with pain and swelling after your surgery. You will receive an ice pack at the hospital to use after your surgery. Use the ice packs as frequently as you need, but no more than 30 minutes every hour. Be sure to have clothing or a thin towel between the ice pack and your skin to avoid frostbite. You can ice anywhere on the leg that is painful or swollen. Multimodal pain management. Make sure you're taking your pain medication regularly based on the severity of your pain. You will have pain medications that are mild, such as Tylenol, meloxicam, or Celebrex. Make sure you take those on a schedule to stay ahead. You can use the stronger narcotics, such as tramadol and oxycodone, as needed for moderate to severe pain. If you're taking the Tylenol and the meloxicam, or the Celebrex, and those two are working to control your pain, continue that schedule. If you start having a little bit more pain, you can add the tramadol. If you have very severe pain, you can add the oxycodone. Just make sure you always wait 1 hour between the tramadol and oxycodone, as both of these can be very strong. Track and wean off your narcotics as soon as you're able to. Narcotic pain medication and decreased mobility can cause constipation. You will have stool softeners and laxatives to take as needed for constipation. And be sure to get plenty of water and dietary fiber as well. Blood clot prevention. We will prescribe you a blood thinner to take after your surgery. Blood thinners such as aspirin, Eliquis, or Xarelto are commonly used. Be sure to take it every single day in the morning with food. Take it for 30 days. It is important that you take this without missing a dose. After your total hip replacement surgery, you will need assistance to get dressed. You will have restrictions of no bending more than 90 degrees at the hip. Here are some dressing tips to help. Wear loose-fitting clothes to the hospital and while you're at home recovering. When you're getting dressed, dress the operated leg first as it has limited mobility, and to undress the operated leg last. Use a reacher, as shown as this image, to help put on pants and underwear if you don't have someone to help you. Wear slip-on shoes for comfort and ease. Again, these restrictions will last for 6 to 8 weeks after surgery. You will need help getting dressed during the 6 to 8 weeks, so it is helpful to have equipment or someone to help you. You can use a reacher or the sock aid as shown in the picture below to help put socks on. Just remember, these sock aids do not help put on the compression socks that you get at the hospital. We recommend purchasing the hip kit to use after your surgery. This can be found online on Amazon or at some local stores such as Rite Aid and Walgreens. It has the long-handled shoehorn, the reacher, the long-handled sponge, and also includes the sock aid. Here's another picture of the equipment that we recommend. In this one, we have included the handheld shower head and also the leg lifter. The leg lifter is very helpful for getting in and out of bed and getting in and out of the car. After your surgery, it is very normal to have weak muscles and to sometimes not be able to lift your leg in and out of the bed or the car. We recommend you use a front-wheeled walker over a four-wheeled walker. Walkers are sometimes covered by insurance. If you have questions on how to get one, please let us know. We want you to use a walker for 2 weeks initially, no matter how good you feel. A waterproof bandage will be placed over your incision after your surgery. You can shower as soon as you feel ready. Shower with the bandage on, but the edges must be sealed. Be sure not to soak the area in a bathtub, pool, or hot tub. And please be sure to have someone with you. Keep the bandage on the incision until your follow-up appointment. That is 2 weeks after your surgery. The image below shows you how much drainage is expected after your surgery. You can expect a small to moderate amount of drainage. If the drainage is ever not contained by the bandage and the bandage is completely saturated with drainage, please call me, Syra, your orthopedic nurse navigator, at 509-282-2876. After your surgery, we want you to sit in the shower for at least 2 weeks. This can help decrease the risk for falls. If you have a tub shower, we recommend using a tub transfer bench. You can sit on the bench from the outside of the tub and slide across to avoid excessive bending. If you have a walk-in shower, you can use a shower chair for safety. You can place the walker nearby to assist you to get in and out of your shower. Occupational therapy can help discuss bathroom equipment if needed to help improve your independence after surgery. We recommend using a toilet seat riser for elevated height and a toilet safety frame if needed. You can purchase these at stores such as Walgreens or Rite Aid and online. Again, these are not covered by insurance. Transfers. Make sure you choose chairs that are comfortable, have armrests, and have the ability to elevate your legs. Don't sit on chairs or couches that are too low, as they can be hard to get in and out of. And make sure you always push off grab bars or chair arms instead of pulling up on your walker. Arrange to sleep on the side of the bed closest to the bathroom. You can sleep on your back or on your side. It is not recommended to sleep on your stomach or on your operated side. If you sleep on your side, be sure to place a pillow between your legs to keep them aligned. If you frequently get up at night to use the bathroom, try to avoid rushing and moving too fast. This is when falls tend to happen. Have a nightlight and lamp for safety at night, and move slowly when turning and backing up. Check your railings to see that they are not loose. In the bathroom, pick up all the throw rugs. We also recommend that you get a walker bag to help free your hands when you're walking around with a walker. You will need a care partner to stay with you for at least 3 days after your surgery, but preferably a week. Ensure you have a plan or a support person to help assist you with transportation to your follow-up appointments or physical therapy. There will be restrictions on driving. If you have a left hip replaced, no driving for 2 to 3 weeks. And if you have a right hip replaced, no driving for 3 to 6 weeks. Make sure you have a plan for shopping and meal preparation, housekeeping, pet care, and yard care. Therapy expectations of the hospital. After your surgery, you will meet with physical therapy. Physical therapy will come see you within 4 hours after your initial recovery period. Their goal is to assess your mobility after your surgery, the level of assistance that you'll need following the surgery, and determine any equipment or training needs that you might still need. They're going to help you walk using your assistive device, such as your walker. If you need stair training or car transfers training, they will also do that as well. You will also meet with occupational therapy on the day of or morning after your surgery. Their goal is to maximize your ability to do what you normally do independently after your joint replacement surgery. They will review education, including safety and accessibility to do your daily activities, transfers related to daily activities such as showering, toileting, and getting in and out of the car, the ability to move around and access your bathroom, the kitchen, and your home. And they can also educate you on how to use the adaptive equipment that we mentioned before, such as the reacher, sock aid, and leg lifter. Before your surgery, please refer to your educational packet that you will receive at your pre-op appointment, or watch this video again if needed. Remember to practice at home. If you have any questions, you can call me, Syra, your orthopedic nurse navigator, at 509-282-2876. I'm available Monday through Friday from 8 a.m. to 4:30 p.m. My job is to be a point of contact and a support person for you throughout your recovery. Thank you for taking the time to watch this video.